that there's better ways to do things, that we have some good ideas. Hope that we can facilitate some of them.
That the status quo across our LHIN is not an option anymore, that the individual institutions, which have been feeling very responsible within their own remits, need to be thinking in terms of being more of an ecosystem of care, a community of practice.
And since I'm becoming a senior of older age, I'm going to be having greater demand on the hospital for their services, and I want to have a timely service if and when I need it, which I am not experiencing at this point in time.
Obviously, the aging population meaning more patient visits, but as well as the aging population of our workforce. At Brothel General, for example, we've got about 33% of our staff who are eligible to retire as of today. So it certainly means that we've got some challenges with respects to recruiting talented staff in the future.
Very positive I can see already is a great deal of consensus around what the key issues are, the importance of patient-centeredness and the crucial need of us working all together. And the very fact that 250 of us are here having these discussions very openly and in concert with one another bodes very, very well for the future.
My big concern is keeping people out of hospitals, having the right people in hospitals, and then making sure that when people leave hospitals that they don't come back.
I think we have strong leadership in that center, and we have, a reasonable degree of trust and dialogue has occurred between different partners, and I would emphasize it that especially at the primary care level, there has already been a lot of integration, and people are working together to try to address common concerns and challenges in primary care.
I think the one overriding thing that came through was the ability to use technology and increase the use of technology and tap into that a lot more than we are now. The changing patient going forward, it isn't so much about today's patient, we always have to consider about tomorrow's patient.
Acknowledging that we can't carry on the way we are, that we need to be thinking as a community of practitioners and a community of organizations is the first sort of cultural challenge that we need to acknowledge and overcome.
We have a patient representative sitting at our table who is asking some wonderfully challenging questions, but it's also interesting to see that I think we can make a difference. I think there's a flavor of innovation and a desire to really look at things from an integrated perspective.
The great openness of all the hospital staff to share their experiences, to share the wants, the needs of the patient, not the hospital, not the medical field, but the patient, to address those patient needs, to solve a problem for all the patients within the southeastern LHIN.
Recognize together that we need to change, okay? And so it seems to me if we want real change to happen, and if we want real collaboration and real integration, okay, we got to accept that notion, and then the ways of how you do it, I think, will be easy.